Hey Zach, how are you?
I'm good. How are you?
I'm good. I'm good.
It's good. Looking good
Here
in
we
your
are.
armchair today.
I know. I've got myself a new little podcasting space actually, which is good. It's nice and cozy for winter coming. So yeah, I'm stoked about that. It's been a bit of a trouble with the old camera, to be honest. I thought you probably get some
I
bloopers.
might have
Post.
to try and get a few bloopers out and about so people can see you trying to fiddle with your camera.
Um, sounds a bit rude saying that. I have a camera situation that follows me. So my camera was over there and it's supposed to be on me and I have to like flag it down to come back over here and I don't understand what it was focusing on, but it wasn't me. So anyway, we're here now. We're
Oh,
ready
good.
to go.
That's
I'm
right.
excited. I
Don't
need
look
to
at the
sort my
past.
lighting out. My lighting needs a bit of work, but that's okay. Hi guys. I hope everyone had a great week. We're going to dive into something today because we're talking about it lots, and that is flu season coming.
Flu season is very fast approaching, Amy. I
I feel
feel
like
like
it's
all of a
earlier in every
sudden.
every year, to be honest. I think when did
Yeah.
we put our order in? It was like January, December.
Oh
I felt
no.
like it was really early.
Early in October, I think we'd already put our order in for this
I was
year.
like, this is a bit rich.
Yeah.
Paying for 600 vaccinations or whatever. It's
Yeah.
been waiting. But anyway, that's the way it is, and we've got them arriving in April. So let's start talking because we're March. So we do need to look at who we're going to bring in for that, how we're going to market it, how we're going to communicate it, what are the flu
Absolutely.
clinics going to look like, what are the do's and don'ts, and what did we learn from last year?
Yeah, well, I think one of the
There's
biggest
lots to
things
talk
for
about.
me, one of the biggest things for me, obviously, is all about doing the setup and the preparation is important. Not just launching once you get a delivery of vaccines. Having some ideas, thoughts, insiders as to how you want your flu clinic to run is pretty important. Patients that come in for that quick 5-minute slot probably don't think to themselves about the level of insight and energy that gets put into getting those flu vaccines in the fridge and having nurses and an admin team available and doctors obviously to administer them. So I think that for me, it's all about the preparation and I guess the earlier phase of the clinics are important. But one of my biggest learnings and something that I think is a bit of a gold nugget for this episode is to not be so resistant or hesitant to give opportunistic vaccines. I know lots of clinics are very much...
And he's not just talking about walk down the street and just jab someone so and as
Oh,
opportunistically
look,
as you walk
whatever
past.
suits. I mean, your business
I
model, I'm
mean,
not going to judge.
when you do that, ask what their Medicare number is. Just
Yeah, exactly. That's the
and
most
what their
important
height,
part.
weight, blood pressure. Make sure you're doing with them.
And have a doctor present with you while you're walking down the street.
Unless you're a nurse immuniser, I mean, all of you can go with a fanny pack full of injections and just.
Hopefully it's a chilled fanny pack. One thing that I think...
Get a little monitor on there as well. Okay, we're going down a rabbit hole.
What I mean by that is there's lots of clinics that stick to flu clinics. Mondays at 9 a.m. is the clinic. So if you want a flu jab, book into the clinic. If not, Wednesday at 10 a.m. Like, I understand why. It's much easier to do that from a stock management point of view. Absolutely. However, what it does mean is you risk at the end of the flu season not having all of your flu vaccines administered and having stock sitting in the fridge you've potentially paid for. If they're private immunisations or even if they're government-funded immunisations, there's immunisations sitting there. I mean, one thing we've got to be mindful of, Amy, when I first started in general practice and was working on flu clinics in particular, we didn't really have that much competition in relation to pharmacies and other sort of providers that were giving immunisations. Now it's a much more, not that it's a competition, but it's a more competitive field. Patients can get them anywhere. They're doing random clinics left, right and centre. They have... pharmacies administering vaccines. They've got there is other options for patients. So what that means is if you're ordering 600 or 500 every year, actually reassess and make sure that that's an accurate number that you need and perhaps base it on what you did last year and what your marketing intentions will be this year. But yeah, I think for me, the biggest thing is to not hold back. And if you have patients that opportunistically want them, just give them. You'd rather get down the track and say, sorry, we're out of flu vaccines, we'll try and get some
Rigidity
more.
in the appointment book can cause issues. And that's one of the things we have learned from last year is that I think the nursing team was so nervous about running out of vaccines and not having enough allocation for the flu clinics that we had already put in and available in the appointment book that we ended up with vaccines at the end. And that's probably poor management, I would say. I know they're taking the risk adverse route because the year before there was not enough, so we were running out. But in saying that, like you've just mentioned, there are different places now to go. I think also that fine line between government and private, a lot of the times we're running out of one or the other, and then you're not really too sure who's going to book into those clinics, whether it could be a clinic full of government, right?
Correct,
Or a clinic full of private. But what we did miss out on, I think, is those opportunistic ones, which are the people that come in and, hey, Mrs. Jones, whilst you're here, have you had your flu shot? And people also get nervous and doctors get nervous because it's like, well, am I giving it or is a nurse giving it? And what if the nurse is not available? It is a 5-minute appointment.
Not even.
So I would suggest if the doctor is there, the doctor takes the patient down, gets it out of the fridge, fills it in. If the nurse is available, go for your life. But it is something that I think it gets put in the too hard basket.
Yeah, and they're quite a routine thing. I mean, it's really a short-term thing when you're looking at the bigger picture. It's not every day that doctors have to give flu vaccines. And I mean, we've been pretty lucky. We've got doctors that are more than willing to jump in and do their bit. I've never run into doctors that are hesitant to, but I think that by being regimented and sticking to your appointment book timing, all that happens is you do risk being left with stock and patients that need the flu vaccine that perhaps find it too difficult to get one at your practice end up going elsewhere and getting them.
Or when you've got a Chemist Warehouse 2 doors down, that's what's going to happen. And the consent forms as well, we need to talk about that. So can we just, first of all, let's go way back because we've kind of skipped forward a little bit. Let's go way back to the setup. First and foremost, I always encourage my leadership team and my nursing team to enroll themselves in any webinars, anything that is online reading, get to know the updated in the government vaccinations. I mean, they're trivalent, quadrivalent, all the different valents that are coming out, childhood, adult. They could change the register of who is and who is not eligible, get a bit of that into your head.
They've actually got the intranasal vaccines this year too.
And this is what I mean. Looking at that, every year there has been something new, right? Whether it's a new cohort of patients that are now eligible, whether there's been a cohort that's been cut off, whether there's I remember when the new quadrivalents came out and everyone was like, oh, what's this? And can I get that? And some patients go, I don't want the quadrivalent, I want the trivalent. Have a think about what you're going to offer in the setup stage. Get yourself geared up with the latest information. So there is the National Immunisation Register, great information on there about what is going to be offered and where the eligibility sits. Print the information off, laminate it and have it ready, not only for you but for your doctors. So put it into every single consult room. Give it to the front desk. Why? Patients are going to start calling. As soon as they start hearing flu vaccinations on the news, because it does happen in the local newspaper, as soon as the likes of Chemist Warehouse blast it all over everywhere, flu vaccinations are going to be the mind of many Australians. So gear your information up at the front desk. Make sure they know exactly who is eligible and who is not, because people will ring and say, can I get a free government vaccination? And they can run through the eligibility. It's not for them to triage whether they are or are not, but it's about the information about the eligibility that's important. And the other thing is also looking at the setup stage, review what you did last year. Because that's super important. There are people out there with all these new ideas about how to run them right now. Cubico's doing a webinar, Hot Doc's doing a webinar, PHN's doing a webinar. It's important for us to all be in those and have a look at what are they actually talking about. And yes, a lot of it is repeated information, bless them. But there is some really important information about the tools that you can use to make this nice and easy for you. Recall systems, nice and easy. Bring everyone back that had it last year, for instance. There is Cubico tracking data. How many have you done? How much stock? They even talk about stock management, which is, again, hard to do when you have a nursing team that's flat chat, right? So thinking about the setup phase, Now is your time. In fact, 2 weeks ago was your time.
Yeah, exactly.
Get onto it.
Yeah.
So I think, first of all, reflection from last year, what worked, what didn't work. And I'll skip to you in a second, Zach, in regards to talking about that. But I think also looking about industry, what are the tools that can assist you in this setup phase? Then bring your team in.
Yep. Yeah. And I think bringing the team along for the ride is really important in this, Amy, not just having one person in your leadership team aware of what's happening, bringing everybody along for the ride, your nurses, your admin team. It should be really the topic of the practice for the next couple of months. If you do focus areas or KPIs, incorporate flu clinics into those projects so that they are forced to be top of mind, because like Amy said, it is going to be top of mind for lots of Australians. So we may as well
all of a sudden, don't be behind the 8 ball.
Join in. Yeah. I think that in review of, I guess, looking at data and understanding, Cubico obviously has lots of great insight. Best practice, you can run queries on immunisations given. There's lots of ways that you can get your data to understand exactly what happened last year. Some simple ways might be looking back on your order history and understanding what you ordered and what you actually had in the clinic. Was that enough? Do you recall running out? Do you recall needing more? Or do you recall discarding of a lot of dosage at the end of the year? So having a look over those sort of points in the initial phase is important, just to understand exactly where you're at and what next steps might be. However, I think overall, looking at the way that you're going to run your clinics this year, are you going to stick to regimented slots in your appointment book? If you are, is that going to work? And are there any changes we should make to that before we get grooving? Do you want to go putting them in times when, you know, your cohort, you might have an elderly cohort at your patient base that is able to come in any day, any time. You might have really young families that need to come in after or before school. You might have workers that are looking for outside of 9 to 5. So assessing what's going to work for you and your patient base is very important, and making sure that you set up your clinics accordingly. Doing a clinic that's 10 a.m. till 12 p.m. On a Monday to Friday might not suit everyone. Your tradies and corporate
just because
families.
it suits your nursing team doesn't mean it suits your patient cohort, and that's who we're trying to fit in with.
Correct. This is not about having availability for where suits the practice, more so where suits the patient, so that you can fill those clinics and get rid of those vaccines and also bill them through accordingly. Amy, probably worth talking as a good segue about billing and your process to make sure that these billings actually do flow through to the front desk. I know that there's been lots of conversation about it. Something you're very passionate about, so you should probably take the lead on what your expectations would be.
Yeah, look, I think a lot of the times when you see this, the government vaccinations fly out the door, and we really, on the ledger of a patient, have no idea of what has gone on. The doctor might charge through a 3 or a 23, depending on what they've done with that patient. Again, great opportunity if there's any 10997s for the nurse to have a chat with them at the same visit. There's a lot of opportunistic care. Whilst you've got the patient in there, you've nabbed them, they've come in for a flu shot, have a chat about all the things they're eligible for. So a great way to segue into something else within their overall healthcare landscape. But when I'm looking at billing, a big thing for me is tracking what happened. I'm big on data. So I want to see how many governments did we do? How many private flu vaccinations did we do? Often patients will come to the front desk or walk straight out, and then that doesn't get billed at all. It might be that they've forgotten to add a consult on if a consult took place, or it might be the fact that they've just forgotten to bill through the private flu vaccinations, which happened quite a lot last year. If we went and looked how many were billed to how many we purchased, unfortunately there was a discrepancy. So that means to me something fell down last year, and that was a reflection I had, and we need to make sure that that's actually improved this year and how we do that billing process. But also the government vaccinations. And people quite often ask me, well, why would you want to track that anyway? I want to know how many we did overall. Now, you can go by appointments, but you'll notice a lot of appointments can be completed and the patient didn't show, I did not attend was put in, someone was taken out at the last minute. We want to make sure that the appointment times aren't the only thing that we can use for data. So what we do is a flu vaccination at $0. So we put it through the ledger with a flu vaccination at $0, which tells us that was a government-funded flu vaccination. So we can then have a look at how many in total did we do throughout, say, 2025, right?
Yep.
That also means that we have the ability to go back and have a look at how many recalls are we going to send out this year in total, not just privates, but government also. Another thing we do with that is eligibility. So any of the eligibility changes or anyone in the cohort of eligibility, we do send them out a recall as well, even if they didn't get one from us in 2025, or any new patients that might have joined us since last time we did a flu clinic. But the billing for this is really important. What I want everyone to remember is just because they've seen the doctor laid eyes on the patient doesn't mean it's a 23, okay? It's a big one. And item 3 is a short, brief consultation. That could mean you're just going through, you're citing the patient, you're discussing the patient, going through any possible side effects, asking if there's any new medications, got a temperature, height, weight, blood pressure, that so forth. Remembering the time there. If you speak to the patient about any other aspects of within their health, or you consult with them in any further than just the basic brief consultation, then you can charge an item 23. So I think you need to sit down with your team and get a greater understanding of the 3 and the 23 when it comes to a flu vaccination. There's many practices out there that have been slapped on the wrist for the 23 rather than the 3 because of the time in which it's taken, right? Remember, we're booking a 5-minute consultation for this patient. However, it doesn't mean that in that 5-minute consultation, it's just that one patient. There's 3 for over a 15-minute period. So if the doctor then goes back to one of the other patients and discusses in more detail, and for instance, someone that has many medications, somebody that hasn't had their height, weight, blood pressure taken for quite a while, updating smoking status, alcohol intake, making sure that what they're doing within their health landscape is where they need to be, discussing anything like a HMR or discussing things like a health assessment, care planning. This is a consultation.
Absolutely, yeah.
So that's where 23 might come into play. I do often, and this is a bugbear, have the front desk decide. I don't like that. I don't like it when a front desk staff member just charges. There's nothing in the has come through to the front desk as yet, so they get a little bit antsy and they just charge a 23 and a private flu vax. And I go, but how do you know that even happened? So we need to make sure that when we're doing 5-minute appointments, so 3 every 15 minutes, that the doctors and the nurses are keeping up with the notes and flowing them through. We do have a little bit of grace period because the patients do need to sit around for 10 to 15 minutes to make sure there's no side effects. So there gives a little bit of a grace period there, but there needs to be a bit of a process in place about how the patient flows into the treatment room. They have, whether it be an item 3, an item 23, flu vaccination, and then they flow out of the practice back to the front desk, taking a seat for a period of 10 to 15 minutes, and then revisiting the front desk to check out.
Yep.
Now, in that time, the nursing team and the doctor needs to be doing the notes and putting through the billing correctly so that the front desk can pick that up and bill that patient out.
Yep.
That's where those billing concerns come in. There can be opportunities, like I said, if the nurse has the time and the ability to be able to sit down with the patient and do a 10997, check up, see how they're going with their care plan, how their referrals are flowing through, if there's any updates in terms of their healthcare management, popping that in the appointment book and then charging through a 10997 is also able to happen in that appointment.
Yep.
So good for us to understand who is and who is not eligible throughout that cohort of patients getting flu vaccinations of a 10997. Now, we've got a little bit of a cheat way because we use Cubico. Cubico does pick up the opportunities regardless of what appointment they're in the appointment book for. That'll pick up the opportunities for us so we can see, hey, Mrs. Jones, whilst we're waiting here for a doctor to come in to do your flu vaccination, can I have a chat about the care plan review that's coming up or a health assessment because you're about to turn 45 in a couple of weeks' time. Those things are really important as well. So I want perhaps to do some planning and preparing around some of these aspects. And so it's not just the billings, but billings come into play when you're talking opportunities. Billings come into play when we're talking about the correct item numbers making its way from the treatment room to the front desk, and also whose responsibility is it to ensure that they are true and correct.
Yeah, for sure. I think there's the only one thing that I would add, Amy, on there is in relation to facility fee cards and perhaps the logistics of getting that notification of whether it was a government funded or a privately funded vaccine through to the front desk. Obviously, facility fee cards are something that we've spoken about quite a lot on the podcast. Resources on the Practice Partners website will show you exactly what we're talking about in facility fee cards, but little cards that actually have a tick box of opportunistic 10997s and also your flu vaccine being government or private allows the nurse to tick each box provide it to the patient provides it to the front desk. The front desk can then add that private or government funded vaccine and be billed accordingly. Obviously, in our case, the government funded will be billed as a $0 facility fee, so that we actually have a tracking on how many were administered, and then your private's billed at whatever your private cost might be. But flowing that through the nurse's responsibility into the patient's hands and then presenting it to the front desk is usually the flow of how we would communicate those things, rather than at the end of the day the nurse hitting the front desk with a list of patients that received which vaccine today, which is a bit clunky. Doing it on a case-by-case basis, we've always found works much more smoother.
One problem we have had is facility fee cards making it to the front desk. And I think it wasn't a standard where all patients were given a facility fee card. What I think we need to introduce this year to make it 100% certain is every patient that has a flu vaccination gets a flu vaccination card. So when they come to the front desk, the first thing that the front desk will ask anybody who is booked in for a flu vaccination was, can I have your flu vaccination card? Oh, I didn't have it, or I wasn't given one. We'll prompt them to ask the question. I think what was happening in the past is some people had them, some people didn't. Sometimes the nurse would just put it on the front reception's desk, and then we don't know who's who in the zoo. When we say to a patient, was it a government or a private, they also sometimes don't know.
Correct.
Right? So, or they're confused about what all that means. So we want to make sure that it's a standard. So every patient that goes in gets given a card. Not, I'll give it to the front desk for you. Not sometimes, not every second patient, not once or twice a day. Every single patient gets a card, which means the front desk responsibility is to ask about the card. And if we know that the nurse is giving everyone a card, there's an issue if one of them doesn't have the card, and then we can go get that information. Yep. But everyone gets a card. No one gets it put on the front desk. There's no cards sitting everywhere. It's every person that comes in gets a card. Yep.
The other thing I'll add is Cubico also last year did track administered doses of the difference between the private vaccine and the government-funded vaccine. And they do that because obviously it's different brand names that are being used across private doses and public doses. So obviously we're tracking this in multiple different ways. Cubico will provide us with data based on what vaccine is entered into best practice or into your practice management software, which at the end of the flu vaccine season, we will have a number. However, for Amy to be able to track it on a fortnightly basis and even on a daily basis, it's much easier to have it on a billings report, which is why we ended up having these billings reports in progress. It can be seen as clunky, and sometimes if you don't have the full nursing support or time there, you might decide to track it in a different way, shape or form. But the $0 fee, the private fee and the facility fee card process that we've got in place aligns with other processes that we have in practice, and therefore we make that work for us. So I think, again, like anything we talk about on the podcast, it's something that you need to take and tailor it to what works in your practice. But sorry, Amy.
Yeah. No, I think the other thing that makes it really easy, and I know Cubico's got some great data, I like the ability for a doctor or a front receptionist or a nurse to jump straight into the ledger and see whether they've had it done.
Yeah.
They don't have to go into any of the appointment notes. Sometimes there's no reason on the appointment notes, and I'm not going through 5 different notes to work out which one of them and if any of them are to do with flu vaccinations. I don't want to have to go into the tab where it shows the immunisations and then we have to go and read and know, the front desk knowing or the doctor knowing exactly what's what, who's who in the zoo.
Yep.
It's easy to jump in the ledger and see a flu vaccination. Very easy. So that's another reason why we track it that way. So it's full transparency across the team.
Yeah, great. Yeah, communication to the patient base, I think, is important, as well as communication as a broader team, which we've briefly spoken about. As a team, I think it's important to keep everybody on the same page, your admin team, nursing team, doctors. From a management level, you don't want to just be aware as a manager of what's happening, or perhaps as an owner of what's happening, because you've agreed on what the budgets might be, where the additional staff may be required, all those sort of things that you'll be discussing at a management level, which then leads you to understand exactly how the flu clinics are going to run. Communicating that to your staff, having clear expectations and guidelines around what you need out of these clinics, and what you need out of the process when a flu vaccine is taken out of the fridge. I think that's sort of where I would stop the communication with the team preventatively and I guess ahead of the flu clinic starting. And then I would maintain regular communication to make sure everything's running well. Admin team, how are you going receiving the cards? How are you going with billing these items? Can we do a bit of a check a couple of weeks in a month in, month and a half in, every couple of weeks, check on how many flu vaccines we've used versus how many we're actually billing. Do they line up? And if not, where's the hole in the bucket? Those sort of things, I think, from a management point of view, you can communicate regularly about. But communicating to your patient base is really what I was thinking when I wrote communication down, Amy. And that's really about making sure patients understand when these flu vaccines are coming available and what your process will be to recall them and book them in. Obviously, some patients are very proactive in the flu season and want to get on the phone very early in the piece and start trying to book appointments, perhaps before clinics even receive their dose of vaccines. So I think that it's important to set clear expectations, understand exactly what's happening from an organisational point of view, try and get a good deadline on when you're expecting your doses to arrive so that you know exactly what coordinating needs to occur beforehand, and be transparent about that with the team and therefore transparent about that with your patient base.
Patients will go other places and you'll find that there will be pharmacies that will get them, unfortunately, before we do in
Absolutely.
medical centres.
Last year we actually found that majority of the local pharmacies had them before we did.
Yeah, and that's what and just by putting patients on a waiting list for us to open their clinics is not good enough. No. Sometimes it's just they want an appointment in the appointment book. Yep. So open up your clinics even probably before those arrive, but bringing in and keep in contact. Like we use McFarlane's as a little plug, and we give them a call and say, when are they expected? When are they expected? Because we want to know, we want them open. That early uptake is going to be really important. I think there is a lot of that gap that gets lost, whether someone's forgotten to do the government order or hasn't kept in contact with their provider to see when those flu vaccinations are in. Sometimes they just want to ring and book an appointment. Doesn't matter that it's in 3 weeks' time.
Exactly.
They want to know that appointment's in the appointment book. So making sure that we do have that early uptake and we make the most of that early uptake. Do have discussions with patients and with your nursing team and your doctors just in regards to how often should these flu vaccinations take place and how long are they lasting? There's lots of murmurs around that they're only really fully effective for 3 months and then it starts declining after that. So if you've got some early people to early intake, do they get 2? Mm-hmm. Do they get 1? Question mark. Some doctors will say, yep, after 3 months you need another one. Other doctors will say they'll be fine. So have a chat in your clinical meeting about what is everybody's thoughts on something like that. Because you will get patients that will ask the question because we had a lot last year that did that.
Yeah, absolutely.
And I felt it was very mixed messages in terms of the response. So making sure we have a chat in regards to that. The one thing I wanted to talk about, just jumping back to preparing, Zach, I've just got it written here as a note and I forgot to mention it. Yeah. Vaccine fridge capacity.
Yeah, big thing.
I mean, we all probably have bigger vaccine fridges than we generally need now post-COVID, to be honest. We all went a bit nuts and bought huge fridges at COVID, right?
Or even 2 fridges.
Or, yeah, in our case, we've got a couple. But having a look at your vaccine fridge capacity. Now, I have walked into practices before, flu vaccination time, and their fridge is absolutely jam-packed.
Yep.
Is that the right thing to do? No.
Absolutely
Is there
not.
a capacity per fridge? Yes. There needs to make sure there's airflow and that we can get the right reading in terms of what's in the fridge. Overflow your fridge, the reading won't be right. So we want to make sure that you are actually packing your fridge correctly. That's something that capacity, even if you have 2 fridges, I have walked in and one is absolutely packed, one's not. Oh, that's where the flu vaccinations go. So that complete area of that fridge is absolutely packed. Spread them out. Make sure you're looking at the capacity so that the storage of those vaccinations are where they should be and compliant. And make sure that we're not missing a government order. They have to be done incrementally. You only have certain amounts that you can order at a time. Please set a reminder to have them done because there are also things in the preparation process that you can be setting up these reminders.
Yeah, for sure. They're good prepare tips, definitely. So I think in relation to obviously we've gone through communicating, we've gone through setting up, we've gone through preparing for these clinics. The next thing that I would go through is monitoring, and I know we don't have much time left, Amy, to keep this one short and sweet, but I think if we try and talk through just monitoring, what would we do to monitor these things? Obviously, the things that we've spoken about, monitoring your data, monitoring your fridge capacity, monitoring billings that are being completed versus vaccines that are being administered or discarded of, making sure that we have clear tracking and everybody's on the same page is really important.
Orders for the privates, when are they arriving? So we'll often, out of our, say, 500 or 600, we'll get half delivered at the start and half delivered at a certain point. Monitor that. Do we need them early? Can we hold them
when
off?
are they required? Yeah.
Yeah.
So keeping everything, I guess, under control, making sure that, I mean, it's standard practice management to monitor these things, but being aware of what to look for throughout these periods. That the hard part here is flu clinics don't run all year, right? We all go through these periods, and it might be your first time managing a flu clinic. And you'll see a whole new lens of practice management because a lot of it is a high demand. Like patients want the flu vaccine yesterday. And that's, I'm going overseas, I need it before I go. I'm going here, I need to get, like, that's the stuff that you sort of deal with. So understanding the patient's need to get these things done 6 weeks ago before you even had the vaccine versus what needs to happen to keep the place running smoothly is really important. So, from me, that's, I guess, my tips to monitor things and keep these things vocal. I mean, have them as agenda items.
Meetings,
Have them as agenda items in your nursing meetings, admin meetings, clinical meetings, management meetings, even talking through the up-to-date information and tips and tricks. So, I think that's really important.
I wanted everybody to think outside the box this year. I think there's lots of things, and as we were one of the practices that threw a few things out last year because of the opportunistic appointments that were kind of avoided with the fear of not having enough for these clinics. I think we need to relook at that, but monitoring, if it is a slow flu season for you, what are you going to do about it? Don't wait till the end of the flu season to go, oh, that was slow. When you're continuously monitoring, you can have a look at that. Is it the fact that your flu clinics are not in the right times or days? Is it the fact that your cohort of patients would really benefit from half a day Saturday? Tee it up.
Yeah. Or is it the fact that you haven't communicated with your patient base? Have you sent them a message, an email, a recall?
Yeah.
Do they even know that you've got your flu vaccines ready to go? As we said, it'll be a situation of squeaky wheel gets the oil. If Chemist Warehouse down the road or Priceline at the other end of the street is pushing really hard that they've got flu vaccines, patients will go in there. They'll get their pack of jelly beans.
Have they brought out their price yet?
No, not yet. I haven't seen much.
It was $30 one year, $25, then $20, then $19.95. I wonder what it's going to be this year. So, and look, I'm not sure what the purchase price was this year, Zach, as yet. About $9 from last year.
Yeah, they're about $9.50, I think.
Yeah, so having a look at what are you doing? Look, I get we all need to make a profit, but if yours are 25 and down the road, just 2 doors down is $20.
Yeah, correct.
Have a look at it and see if that's the reason things are slow. So we want to break even on these, and obviously, it is a nice time of year because there is reason for patients to come in. We do often have fuller appointment books anyway, but having a look at what are our flu vaccination clinics doing and are we where we want to be at a certain time. I'm a big advocate for planning in advance and saying, okay, so if we've got, say, 500 and say there's, say, 3 months of real intense flu vaccinations, what do we want to hit by month 1, 2 and 3? And are we going to hit that? So when you're looking at month 1 and you want to be pushing out at least 200, okay, well, are the 200 done in that first month? No, we only pushed out 100. Oh, we're 100 behind. What are we going to do?
Yep.
So start to have a look at what you have been doing. You can't set this data out unless you know what happened last year and also the year before. So go back and have a look at that information and then see where you can plan that. If you have no idea of how to run these clinics or how to set them up in your appointment book, reach out to us. We're more than happy to have a chat with you. I know with something like Best Practice, we actually run a clinic, a row that's a clinic, and we overlay that into one nurse's row and one doctor's row. So when we do that, it means that we've got a nurse and a doctor allocated to that clinic, and that clinic has a row. We can make it a 5-minute appointment row. We don't put them in the normal appointment book with doctors because they are 15-minute slots in our practice. So having a look at how you might overlay that to make it easy to book online, but also it doesn't interrupt the daily flow of your practice as well.
Yeah, for sure. And I guess the final parting advice is to attend your webinars, do your research ahead of time. The best time to register for your webinars was a couple of weeks ago. So if you haven't yet, jump on. Hot Doc has one on the 26th of March that I'll be attending. So
I think
all eyes on that one
as well, actually.
Yeah.
So having a look at that to
keep an eye on them, attend multiple, get the advice and insight you need, and listen to this podcast again.
And you know what? We have a lot of people come out to us and say, hey, I've got a question about this or that. More than happy to answer questions. If there's enough people asking the same question, we just bring it to the podcast. But if you do have a question or you're unsure how to set them up or unsure about the preparation process or just want some advice on things we might have done, tried, tested, didn't work, did work, please jump on to info@practicepartners.com.au and send us a little idea of what you're thinking. More than happy to help.
Yeah, sounds good. Well, thanks, Amy.
You're not alone, guys.
No, not alone at all. You know, we haven't done for a while is an email sign-off, but I won't throw it on you if you don't have one ready. We'll give you one at the end of the next episode on email sign-off.
You know what? It's actually been coming up on my Instagram. I must have now a little...
The algorithm's caught you.
Yeah, algorithm's got me. And it's funny doing funny sign-offs until your boss knows. I think I might have forwarded a couple to you.
Yeah, I think you'd find out straight away. You'd know straight away.
Yeah, I reckon too. But very funny. So, and look, if you haven't done it, guys, jump on it and do it and see if your boss realizes.
When they crack it, that you've gone on and given a sign off, just flick them a link to the podcast. I
also like Zach, the come to a meeting and drink out of something other than a cup. Yeah, it's super. Yeah, it's funny. Just like, and I'm just going to ramble here, but this is interesting for anyone else that gets this same algorithm. And you know what? Now we're all going to after we listen to this. But
correct.
There's this new game when you're driving in a car. Next time we do a road show, Zach, we're totally going to do it. And as you're driving past a car, you both look at the driver and you go 1, 2, 3, and you've got to say the name of the driver.
Right.
So,
okay.
you know, it's been on Instagram and, you know, you're looking, so they're looking at the driver. They go 1, 2, 3. One goes Karen, the other one goes Susan. I was like, I could just picture what that person looks like in my head.
But the problem is you're going to have Susan, Jenny and Sharon every time. And Mrs. Jones.
But I thought it was hilarious. Anyway, some really fun games that we might
A few good games for our next road show that we go on, that's for sure.
Absolutely.
Maybe we'll have to take the podcasting gear and do a live podcast on the road.
And any practice managers out there, next time you have a meeting, even if it's like wear something that you wouldn't usually wear, or, you know, some people did like a funny earring day until the principal GP realised.
Yeah, right.
So, you know, next meeting you come to, get everyone to drink out of something other than a cup and wait till the principal GP goes, what is going on here?
Why are you all drinking out of these random objects?
I was drinking out of a vase. I was drinking out of a baked beans can. Like, I was like, yes, this is great.
That's hilarious.
So, I don't know, some ideas to get some culture running through your practice as well.
Love that. All right. Thanks, Amy. We'll see you on the next one.
See you. Bye.